perception as well. And then I talked to them about, you know, I've had chronic metastatic bone cancer client patients in a hospital who are begging to not receive the morphine so they can be clear and spend that quality time with their family.
Yeah. Well, the people on high doses, they don't know that they're impaired. That's like trying to take keys from a drunk at a bar, right? Now I'm fine. I want to tell you about Lewis. Lewis is a guy I just heard from today, actually. Lewis is a guy who came to my office back in 2011, maybe. He doesn't remember coming to me. And when he came to me again as a new patient now, because it's been a lot of years, I recommended again that he come off of the opioids. He broke his back when he was 16. He's now 31. And he's on really high doses of opioids. And he was slurring his words in my office. I told him, we've really got to get off the opiates. You're crazy. I have a broken back since I'm 16, and you don't know what you're talking about. Well, I saw him about a week later in the hospital with an unintentional overdose. Saw him for a few days in the intensive care unit, and he left. And he showed up in my office again, not remembering having been in my office a month earlier, not remembering seeing me in the hospital. But my name was on his discharge paper, so he showed up. And to make a long story short, I did start him on Suboxone. He was on very high doses of opioids. And I did the induction on a Friday, gave him my phone number, kept in touch with him over the weekend. Saturday he was doing great. Sunday I didn't hear from him. Monday he's in my office. And the exam room door is open. He's sitting there. And he's like tapping his foot. He's looking a little agitated. He's staring me down. I'm running late, which happens a lot. And this is one of those rooms I'm just dreading to walk into. I'm going to get beat up again. I'm going to get yelled at again. And I'm another hater. This just, it's hard. So I finally walk in and I sit down. I'm like, hi, Lewis. How you doing? I'm really pissed off. I'm like, yeah, I kind of figured that out. What's going on? What he said next is chilling. I have no pain. I said, well, that's a good thing, isn't it? Like, I'm all happy, right? He's like, I lost 16 years of my life, and he's not joking, he is really pissed off. And he starts going on a rant about what he missed and his family, his life, just everything. It was horrible. I wanted to cry. And then I held his hand and I said, well, Lewis, we're not going to look there. We're going to go forward because now, look, you feel great. You're doing great. You know, that's great. Let's move forward. We're going to move forward from here. And so we did. So now we're dealing with his anxiety and his depression. I have him seeing psych, and he's doing amazing. He's really doing amazing. But, I mean, and his mother was Sanjay Gupta's first grade teacher, so she's apparently writing to him. You know, people are going national, and we need more people to tell that story. My doctor's wife, Lewis, I got more. I can tell you about this all day long. And I have plenty of failures, too. People don't want any part of what I got to say. It's a balance. We're getting there, right? I save lives one at a time. That's all I can do. And then I can teach whoever will listen. Thank you.
Thank you.